Take a look at how things have not been easy for African health workers since the first coronavirus case was reported on the continent. And we are not just talking about mental and physical exhaustion, but also challenges that seem to cut across the continent, including the lack of PPEs. That's personal protective equipment and human resource shortages. We've got a couple of stories on this. We start off with Daniel Arap, who takes us through the conflicts on the continent and the challenges that health workers are grappling with.
It's yet another day for medics in this quarantine facility in Libya's Misrata city. These health experts are working in a country that has not known peace for almost 10 years now. While some of them are lucky to be alive amid the conflict involving the Tripoli-based government and Eastern forces, some have already had an unhealthy encounter with the coronavirus.
I felt everyone's pain. I felt the symptoms they experienced. They are very severe symptoms, especially the tightness of breath. It was the hardest thing I went through since my diagnosis. Suddenly, the air starts to decrease bit by bit until you reach the point where you feel like you're losing your life.
For a nation like Libya, whose resources are limited due to the civil war, treating the sick is a patriotic call for some.
We started in March but closed for several reasons, like poor organization, for a month. Ever since we reopened, we have not received any salaries from the state.
Libya is not the only African nation that are in the middle of nowhere as far as peace is concerned. Sudan, which is also in North Africa, has been experiencing its own challenges with ethnic fighting in some states. Red Sea port is one of the flashpoints. In the Sahel region, things are not rosy. An Islamist insurgency is slowly taking root. Groups linked to both Al-Qaeda and ISIL have been visiting death and destruction on many local communities, leading to outrage amid displacements. Mali, Burkina Faso, Niger, Chad, and even Nigeria are some of the worst hit nations. The insurgency has already claimed its first casualty. President Ibrahim Boubacar Keïta of Mali.
Now, the major problem in Mali is that in addition to now the military coup d'etat, we have terrorists from the various terrorist groups that are operating across the Sahara and Arab Maghreb. And most of them are finding easy places in the deserts of Mali. And therefore, that is an additional problem. And what one would quickly recommend is that we need to return to democracy in Mali so that the government of the day can deal with the challenges that are coming from the terrorists.
Eastern Africa is not resting easy. Somalia has been dealing with an insurgency by Al-Shabaab for over a decade now, and there seems to be no end in sight. Democratic Republic of Congo are two regional focal points of conflict. In Eastern DRC, instability has been the new normal since 1997. Supply for medical equipment and other essentials is badly hampered. This has also affected distribution of aid to affected communities.
Congolese healthcare workers in DRC are trying to respond. They're affected. Sometimes they have to work with very little resources to protect themselves, but they are so dedicated and resilient because to help the people and to serve their own communities. They also have support from international organizations, even though it's not sufficient support to cover all their needs. They are really trying to cope in terms of adapting their normal responses and their normal activities, also to factor in COVID and Ebola in the western part of the country.
Now, a new front is open in Mozambique. An Islamist group that has already pledged allegiance to ISIL is trying to stamp its authority in Cabo Delgado. This is a region that shares a border with Tanzania. Well, coronavirus is also spreading in these countries as health workers do the little they can under the prevailing circumstances to curb its spread. Since the coronavirus was declared a pandemic by the World Health Organization earlier this year, the world has learned the art of keeping safe. It has taught us the importance of keeping the disease from each other. But for countries at war with themselves, the disease is riding on issues that divide the peoples of the affected nations. Healthcare workers are the obvious collateral. Daniel Arap Moi, CGTN, Nairobi, Kenya.